Hello, everybody. Good cheer, and I'm so grateful and I'm so honored to celebrate the legacy of Dr. Provonsha and the fact that I'm standing in a room where so many people were influenced by him is just so very, very special. This is the third time that I've connected with the good folks of Loma Linda. The first was at a conference on medicine and religion where I met the gang, Grace and Yishin and Zane and Amy. And then they were kind enough to extend the right hand of fellowship to this old church pastor, and I was here to visit with the med students back in September. And that was great. And that's when I really got the experience of being part of this community, because Zane took me to worship, and I hung out with the students, and I had spicy Thai food with Grace, and I realized that what happens here on campus is so important and so special for the people of this community, but really for the whole country, for the whole world, that what happens here really models this integrated, this integration of whole person care, of how we can love people as their pastor and as their physicians and as people. So I'm humbled that Grace asked me to come back and to share a few thoughts because I've been walking both sides of the aisle for a long time now. So let's jump in, shall we? The topic today is the philosopher, the scientist, and the new age of medicine, an intentionally broad, vague title to attract your interest. This is to establish my bona fides as a super nerdy history wonk. So on the right, on your right, that is me taking a selfie with a Vesalius, who will be prominent in a few slides. That is our copy that we have at Yale. And then I might be one of the few people in the world that has a selfie with an old Renaissance manuscript. But I got two selfies of the same book, but from two different places. So up at the top, I was at Cambridge on a triennial in England, and there it was, another Vesalius. So I'm a nut for these questions and these old manuscripts. And as we move forward, gosh, it feels like we've been here before. Okay, so I've been very interested as a medical educator, as a physician, about how we identify as healers. How do you identify yourself as a healer? And so that's what we're going to talk about. And this whole year with my residents, we've been using the lens of history to understand how we identify with our role as a physician. Are you a priest? Are you a philosopher? Are you a scientist? Are you something else? And I invite us all to ponder this question for yourself using the lens of history. Okay, so this is what I mean. If you were sick in the ancient Greek world in the 5th century BCE, you would seek a consultation with a priest of Asclepius. So you would travel up into the mountains to the Asclepion, and you would have an intake interview with one of the priests who would ask about your sleep habits and your sin and your bowels and your family relationships, and then you would be invited to spend the night in the temple of Asclepius. And as you entered the temple, there would be these great stelae of the miraculous healings that have happened in this place. And there would be snakes slithering about, and then you would spend the night in the temple, and then in the morning you would have a consultation with that same priest, and you would interpret your dreams, and then based on the interpretation of those dreams, you would be prescribed various treatments. purging or diet or rest or certain herbs. And so if you were sick in the ancient Greek world, you would consult a priest. Now, you see there's the ruins of an Asclepion, and there's a priest, or there is Asclepius, and you see the snake there. And this is a familiar sign, right? Because this is the shield of the caduceus. The snake is a symbol of medicine. Does anyone know why that is? It's because the snake is a symbol of resurrection. Interesting, right? Because the snake sheds its skin. And you are all familiar with the story of Moses, when the people were in the wilderness and a plague was struck upon the people, and Moses raised up a bronze snake, and if you looked at the snake, you would be healed. And that tradition, the Moses tradition, is how we got the symbol of the caduceus, that it came from Moses to Asclepius. But before that, so 3000 BCE, the snake was a symbol of new life in the cosmology of ancient Egypt. So an official tangent, snake, symbol of resurrection, but now we're back on track. Okay, so if you were sick, you would see the ancient Greek world. Hey, folks in back, could you put my slides on this screen right here? It says welcome home alumni. There we go, so then I don't have to go like that. Okay, all right, now, if you were sick in the Middle Ages, in the early Middle Ages, you would encounter the teaching of Hippocrates and Galen of Pergamon. Galen was a physician who earned his chops in the gladiatorial battles of the Roman Empire. And Marcus Aurelius, the great philosopher king, said that Galen was the first among all physicians. He did something very, very important. He took the teachings of Hippocrates, the black bile, the yellow bile, the blood and the phlegm, and he codified that and expanded it and wrote extensively about how these four humors cause disease, how you were sick because of an imbalance of these four humors. He wrote so much. His Canons of Medicine was on the bestseller list for medical school curricula for 1,300 years. Yes, 1,300 years. And you see there, he wrote the treatise that the best physician is also a philosopher. And that painting depicts Hippocrates conveying his wisdom to Galen. So this is amazing. 2/3 of the extant Greek literature from the ancient world comes from Galen of Pergamon. And Pergamon was a center of learning second only to Alexandria. You've all heard of the Library of Alexandria. Well, Pergamon was in now present-day Turkey, and was the second largest library. So a learned man who treated gladiators and emperors and gave to us this model of illness and healing that persisted for the next 1,300 years. Yeah, amazing. This is the chief resident of the MedPeds residency program. His name is Galen of New Haven. And so if you're a resident in the MedPeds program, you're going to visit our historic library. And we were doing a noon conference there. And I said to the head historical librarian, I said, hey, this chief resident, his name is Galen. And she said, oh, let's go visit our Galen collection. So that's Galen of New Haven taking selfies with medieval Latin translation of Galen of Pergamon. Anyway, I'm just sort of proud of how we've incorporated that into the curriculum of the MedPeds program. You know, little medieval Latin never really, can only help, right? Okay, so this model of the four humors is so fascinating in the depth and breadth by which it was developed. So you guys have heard of a sanguine personality, right? Well, if you had a sanguine personality, that meant that you had robust levels of blood in your body, and you were courageous, and you were hopeful. But if you were depressed, introspective, that might be because of an abnormal buildup of melancholia, right? Of black bile. But maybe you're cold, thoughtful, introspective, unemotional. Well, surely that is a strong preponderance of phlegm in your system. But what about that type A, short-tempered, ambitious person? That person has the yellow bile coursing through their system. So it wasn't just physical illness, it was personality. And not only that, good friends, this 4 humor model extended to astrology or cosmology, and that every humor was associated with a planet. And so on the right is just an old version of that. So you can see here that in the upper right you can see Jupiter or Aries, and it goes down there, and that's Jupiter's associated with the sanguine, with blood in your system. And so depending on your astrologic sign in which you were born, if Jupiter was moving into your astrologic sign, well, that could impress upon you a swelling of blood in your system that could cause disease. There's on the lower right there is Luna, associated with aqua, water, and it's associated with phlegm. So with the phases of the moon could impact your personality and your mood and your physical health. On the left is a more modern version about how every humor was associated with a core element: fire, air, water, and earth. And so phlegm was associated with water, which was associated with winter, which was associated with being of a seasoned age. And so depending on the season and your personality and the astrology, it all wove together to impart health or illness. And so the key to health was balance. The key to health was to give opposing treatments based on the abnormal balance. So if you had too much blood in your system, if you had too much hot fevers and were burning up, well, clearly the treatment then would be bloodletting. And that's how we got the tradition of bloodletting. That persisted for 1,000 years, right? If you had too much of a buildup of blood above your shoulders, clearly that would result in baldness, right? Because your hair would burn up from all of this abnormal heat trapped up there. So clearly the treatment would be cooling poultices on the top of your head, you know. So fascinating, right? Fascinating, complex, rich, which makes sense because it just got deeper and more complex over, centuries and centuries and centuries. One person I want to highlight is Hildegard of Bingen. Raise a hand if you've heard of her. Okay, so many of you have and some of you haven't. I'm delighted for those of you who have, and for those of you who haven't, I'm even more delighted because I get to talk about her. So Hildegard of Bingen was an abbess in Germany around the late 11th, early 12th centuries. And she is probably the most influential female during the whole medieval period. I mean, you could make an argument about Teresa and Clare and some of the other mystics, but I actually think the prize should go to Hildegard of Bingen. She did many, many things. She was an abbess. She preached in all of the great German-speaking pulpits Cologne in particular, which was a conservative bastion, in Munich and other places. And that was unheard of in the medieval period, that a woman would preach in these grand cathedrals. What she contributed to your life and my life is that she integrated Christian theology, herbal medicine, and the four humors. And she wrote these treatises. Scivias was one which really reads like a manual of illness and healing, and goes through and describes how Jesus was a healer, and Jesus healed in these contexts, and how the four humors related to that, and how these local herbs could treat and restore balance to the four humors. She was an amazing, amazing, powerful intellect. She also made a unique contribution, this idea of viriditas, or greenness, that the power of God to heal you was a green light, a green energy, and that the way to heal the body was to treat the body as a garden. There's this wonderful book, God's Hotel, by Victoria Sweet, who really raises up this idea of the body as a garden. So instead of trying to intercede and invade, the trick is to nourish and prune out the weeds and remove impediments and allow the body to heal itself. So the body is garden. The other piece that's so amazing about her is her music. So if you go on the Google YouTube web and you type in Hildegard of Bingen chant, you'll see that her stuff still plays 1,000 years later. So this idea of physician as priest shifts a great deal to this idea of physician as philosopher, and philosopher in the broadest writ, right? Philosopher as astronomer and theologian, natural scientist. Hildegard of Bingen, viriditas, the healer as philosopher. I want to raise up the contributions of the Islamic Golden Age. We don't call it the Islamic Golden Age anymore, but because it implies that there was something before and something after that was lower, and that's not true. But I think in common parlance, it's helpful to recognize that there was this wonderful flourishing of growth and intellect, and we in the West owe a debt to Avicenna in this amazing period of flourishing during the 12th century in Persia. So Avicenna was another one of those folks who integrated faith and modern medicine as he knew it. He founded hospitals. He was a physician to the great courts, astronomer, psychologist, poet. And he was, his important contribution was he reconciled Islamic philosophy and the four humor theory, Galen's four humor theory, as well as with Aristotle. And he was the one who first proposed this idea that if you encountered something and that it seemed logical, but it contrasted with Scripture, i.e., in his case, it contrasted with the Quran, that you would lean towards logic, you would lean towards reason, and seek perhaps an allegorical way of interpreting the Quran, which at the time was very controversial and very much about integrating these two worlds rather than keeping it separate. And again, he also wrote a piece called The Canons of Medicine, which was used in all of the medical schools up until the 18th century. So amazing, right? So all the academics, I feel like any paper I've written, if it gets read by 10 people, I'm happy. So the idea of these great tomes being in popular use for centuries is really, really amazing. So he was a trailblazer in this idea of healer as philosopher. The other person I want to raise up from the great Islamic tradition. So Avicenna was in the far east side of these Islamic empires. In the Iberian Peninsula, there was Averroes, who came about 100 years after Avicenna. And we owe a special debt to Averroes and the work of his lab. At the time, after the fall of Rome in the 5th century, learning declined, and there's some debate about that, but learning declined, that nobody in the West really learned Greek, that many of the texts of Aristotle, Plato, and others had been lost to the West, but they were being incubated in these Islamic empires, in these Arabic empires, and they were translated from Greek back into Arabic, and then they were reintroduced to the West by Averroes in the 12th century. So the West had been deaf to the teaching, or blind to the teaching of Aristotle for many hundreds of years, and through the translation of Averroes, these ideas of Aristotle were reintroduced into the West. And so this work of translation, and it wasn't just that the texts of Aristotle in particular were reintroduced. They were reintroduced, but with commentary by Islamic scholars. And so they came back richer and more nuanced. And his work is one of the main reasons why we had the flowering of the Renaissance a few hundred years later. The other big driver of the Renaissance, of course, was the fall of Constantinople in the 15th century, where many Greek scholars fled to the Latin-speaking West. And then the other piece that's so amazing, so that painting on the left there, you guys are familiar with Raphael's School of Athens, where you see Aristotle is there with his hand extended, and Plato is there in the papal apartments with his finger pointing up, and Aristotle is there because what is real is what you can see, feel, and touch. And Aristotle is thought to be the father of science, and Plato, what is real are the ideas, the forms. Averroes is the only Islamic philosopher pictured in the School of Athens. And then we've all heard of the Sistine Chapel, right, by Michelangelo. So Averroes is the only Islamic scholar, only Muslim who's featured in the ceiling of the Sistine Chapel. So even in that period, the 15th century, 16th century, Averroes was well regarded. So Healer as philosopher, and a nod to honor the Islamic world and the contributions that have been made to our traditions. Let us press on. Okay, all right, you guys, take out your phones and see this right here. Okay, take out your phones and go to that QR code. And if it says you got to register, just hit skip. And give me a thumbs up if you found the website, if you got there. You got it? Okay. So the question is, what is the bone of luz? What is the bone of luz? We're still in this space of the healer as a philosopher, but things are beginning to change. What is the bone of luz? Is it the structure from which the body can regenerate? Is the bone of luz named after light, where the seat of wisdom lies? Is the bone of luz, is it the orbital bones? Is the bone of luz a mystic relic from a Greek temple with healing properties? So everybody, based on the wiggle of the bars, thank you so much for playing. And so the bone of luz, what is the bone of luz? The structure from which the body can regenerate. Is the bone of luz named after light, where the seat of wisdom lies? How about the orbital bones? Nobody's voting for the orbital bones. A mystical relic from a Greek temple with healing properties. Excellent. Give me a thumbs up if you've voted or decided not to vote. Oh, I should tell you, it's totally anonymous, by the way. It's just to check the temperature of the room. Okay, so can I just tell you, I was like kind of nervous that this part of the talk wasn't really going to work, but this is fun, you guys, right? Like, what's the bone of luz? I don't know. All right, I'm going to tell you. The bone of luz is the structure from which the body can regenerate. And so even though I said it was anonymous and confidential, who voted for that? Because someone's, and was it a guess? Was it a guess or did you know? Yes. Okay. So the bone of luz was this mysterious, mythical bone at the base of your spine. Sort of a foretaste of the pluripotent stem cell, perhaps, right? Okay, so it was this bone at the base of the spine that old man Dr. Galen wrote about, but nobody could find it. And of course, Galen famously, we believe he never dissected human beings. There's some revisionist theories that say, well, he must have dissected some human beings. The way Galen learned anatomy primarily was taking care of gladiators who would get bored and slashed and stabbed and stuff. But at the time, to dissect a human being was a sacrilege. So we think that Galen's, oh good, someone voted, someone got credit for, I saw it move. Anyway, so Galen made this proposal, but no one could test it because people couldn't dissect human beings until the Renaissance. And so Vesalius publishes his Fabrica Humana in 1543. Just one way to remember this date is everyone knows Gutenberg's Bible. Gutenberg's Bible was 1453 or 1450. Anyway, around that time, you should just switch the two middle numbers, and that's how you get Gutenberg's Bible, and then you flip them back, and that's how you get Vesalius. And of course, 1453 was the fall of Constantinople. So Gutenberg's Bible and the fall of Constantinople around the same time. This came 100 years later. Vesalius was and is the greatest anatomist ever to have lived. And he published the Humana Fabrica. It made him famous in his lifetime. And at the time was the flourishing of the Renaissance, where discovering, observing, delving into the natural world now became a priority. And that included delving into the natural world of a human being. And everyone knows Leonardo da Vinci's wonderful drawings of the human body. So Vesalius was part of that wonderful wave of introspection and exploration. So this is the cover, the woodcut of his Humana Fabrica. And I just want to walk us through it. The coloring came later. It's just a black and white woodcut. But it's marvelous. So on the table is a donor. Now, back in the day, to be a donor meant that you were an executed criminal, essentially, and that you would be dissected the next day. And it was thought to be a diversion from criminal behavior because you would be dissected the next day. So there's the cadaver. At the bedside is Vesalius, and you can see. I wish I had a laser. You can see he's pointing to this gentleman here in the yellow robe on the lower right, and so that person is Galen. And Galen is looking down, and you can see there's a dog there, and he's looking down as if to say, oh, you got off the hook. We're not dissecting animals anymore. And you see Galen is pointing back to Vesalius. Vesalius, he's going like this, pointing to Galen, but he's also pointing up. And he's pointing up to the skeleton. And the skeleton, as if to say, where's the laser? Oh, hold on. Ooh. Okay, Thank you. Laser. Okay, Galen pointing to Vesalius, Vesalius pointing to the skeleton. This position is the position of the lector, that before Vesalius, the lector would read from one of Galen's texts, and the butchers would be doing the dissection. But Vesalius says, aha, in this new age of medicine, the true teacher is the body in the position of the lector. Vesalius is at the bedside, because if you're going to be a physician and a teacher, you need to be at the bedside. And these are the butchers who are now relegated beneath the table because they don't have a job. Isn't that charming? In a way, it's like there's so much that is conveyed, even though the eye might just sort of pass over this woodcut. Oh, interestingly, we don't know who did the woodcut, that the person who did this masterful work is lost to the mists of history. So, physician, healer, as philosopher, but this is starting to feel a little bit different than Galen. Okay, there are many, many, many in this era of physician as philosopher, physician as natural philosopher. And I just want to raise up, Harvey discovered that circulation, discovered the system of circulation where the heart would beat the blood to the body, and then somehow the blood would return back through veins back into the heart. This was a radical concept. Before this time, 1618, before this, we believed that the blood was created in the liver, was pumped by the heart, and then kind of disappeared somehow in the extremities, and so that the body was always making more blood in the liver somehow, and making more blood, and making more blood, and it would disappear, it would disappear, it would disappear. And then, no. Harvey figured out that when you tamp down your veins in a certain way, the veins fill up. And he drew the picture, and that's how we knew that blood returned to the heart. Amazing, right? And this is 70 years after Vesalius was doing his anatomic drawings. It took a long time. And then Morgagni, decidibus, which means the seat of disease, 1761. Now we're talking 200 years after Vesalius. Morgagni codified up to date, essentially, the way we use up to date. He created a version of up to date. Essentially, he figured out anatomic basis of disease. So if you had anorexia, fever, and right lower quadrant pain, well, you would die, and when we opened you up, there would be this appendix that would be inflamed and purulent. He didn't know why it happened, but realized that if you had certain symptoms, it would result in certain anatomic changes in your body. And so the seat of illness, decidibus, had one book that was a description of symptoms, another book that was a list of the anatomic parts of the body, and you could cross-reference symptoms and anatomy to a third work that would describe all the illnesses that pertained to that system. Amazing. And so he was famous in his day, and every court and institution of repute across the West would have their own copy of Decidibus. So again, still in this realm of natural philosophy, but it feels very different than Galen. I didn't do this as a poll everywhere, but René Laennec was one of the most famous French physicians of this era. What did he invent? The blood pressure cuff, the stethoscope, the microscope, or the ophthalmoscope? Anyone want to shout out what it is? Yeah, stethoscope, exactly right. And I highlight this because the center of medicine in the 18th century, late 18th century, early 19th century, moves from the universities of Italy to Paris. And this starts to look a lot more like modern medicine, where these ideas of public hygiene came into the fore. So instead of a hospital looking more like a church, all of a sudden the windows were open, the ceilings were higher, it was important to have cross ventilation, and people were housed in wards based on your symptoms. So there were a children's hospital, there was a hospital for skin diseases, there was a women's hospital, and this is where modern medicine starts to, medicine in the early 19th century, late 18th century starts to look a lot more like how we do it today, where there would be an attending physician, that there would be a group of learners, residents, or junior faculty, and they would go from patient to patient to patient to patient, and they would make examinations, and they would make prognostications. Treatment, therapeutics, was very, very poor at this time. In fact, there was not much that we could do in the way of healing, but we could make prognostication, which could be of great comfort to the family. We believe you will get better. We believe that your loved one will perish in the next month or so, right? So it was diagnosis and prognosis, and this idea of examination, and medicine starts to look a little bit more modern. So, but physician as scientist comes into the fore in the late 19th century, and the center of medicine shifts to Germany. This is a photograph of Robert Koch. And so if the stethoscope was the instrument of French 18th century medicine, 19th century medicine, the microscope was the instrument of 19th century German medicine. And this is where the physician as scientist dons his or her white coat. I guess at the time, his white coat. Robert Koch was a frontier physician who grew botulism, anthrax, and TB in broth in his kitchen. And he figured out through the microscope that there were these microscopic entities that if you took that, you could inject it into a rabbit or a mouse, and they would get sick with botulism or TB or anthrax or cholera. And then you would extract pus from that dead mouse or rabbit and look at it under the microscope, and you would see that the same bacilli was visible underneath that microscope. So the Koch's hypothesis, that's where that came from. And this strict evidence-based medicine really came into the fore. So from Vesalius and the physician as natural philosopher, where things begin to change, physician as scientist with a white coat comes into the fore 400, 500 years later. Okay, this is for the med-ed wonks here. So in 1910, there was the Flexner Report, which was funded by the Carnegie Institute. Abraham Flexner was a PhD. He was an educator, and he was charged with evaluating all of the medical schools across the country. And at the time, there were 148 medical schools. After his report, there were only 66. And Flexner raised up this German model of medical education, where the idea was that you needed to have 2 years of hard science, followed by 2 years of patient experience. And the finest medical schools were those that would have access to robust laboratories and a plethora of patients. And the #1 medical school at the time was Johns Hopkins. So this is the moment when physician as science truly becomes institutionalized. It had repercussions across the country because some of the more tutorial or guild-oriented experiential medical schools were forced to close. And there were 7 schools that were historically black institutions, and all of them closed except for Meharry and Howard, which had a huge impact in the care of black and brown people in this country. Okay, I'm going to fast forward through this because I want to get to my other poll everywhere questions. But in 2009, the ACGME, this is the Accrediting Council of Residency Programs, they said, look, it's not just about how much you know, fund of knowledge, and it's not just how you take care of patients. Well, there's this other stuff too, practice-based learning and system-based practice and how you communicate and these ideas of professionalism. And so it's interesting, right? In the 1910, we raised up the importance of fund of knowledge and science. And then we quickly realized that, wow, medicine is getting more complicated. In fact, medicine, the medicine side of medicine is really easy, right? Amoxicillin, Biktarvy, order an MRI, right? That's easy. But how you get a patient with Medicaid to get that MRI in a timely way without being on the phone with prior authorization folks, that's a big deal, right? How to get someone discharged on a Friday afternoon when they don't have a place to go, or more to the point, they can't walk up the 10 flight of steps that they have. That stuff is hard, people. I'm seeing some nods in the audience. So yeah, you guys know what I'm talking about. That the medicine is easy, but everything else is hard. So I invite folks, if you just go to your phones, what age are we in now? So I'm going to go back. It should just automatically go to your phone. Give me a thumbs up. Did it do that? The new question, what age are we in now? Okay, so are we in the age of technology? Are we in the age of synthesis? Are we in the age of modernity? The age of anxiety. The age of anxiety. Or are we in another age? The age of Taylor Swift and Beyonce, maybe. Age of technology, something else, synthesis, postmodernity. I just put that up there. I don't even really know what postmodernity is. It just, yes, we're in there now. There's a strong, so let's see, postmodernity, anxiety, technology. So, all right, the strong bar graph on technology. Synthesis, a lot of people voting for synthesis. Pretty interesting. Postmodernity, age of anxiety. All right. Okay, nice. Hey, everybody, thanks for playing. You know, it's nice to watch it, right? It's interesting, right? Like, what are you going to vote on? Ooh, what are your colleagues? Hey, who is that person sitting next to you? What did they vote for, right? It's kind of interesting. Okay, so so it looks like technology is getting all the delegates there. Sorry about that. Little political vote humor there. Okay, so I actually think we're in the age of synthesis. Oh, who said that? Oh, from Hegel? Or just you were thinking of it? Okay, nice. First of all, I've given this talk like 2 or 3 times before, and you're the first person who was like, yeah. Woo. All right, so the age of synthesis. So George Frederick Hegel, 18th century idealist philosopher, had this really interesting idea about synthesis. And his idea was this. You have your thesis. The patient has volume overload. But then you have your antithesis. The patient is dry. He didn't talk about patients, but for the sake of this example, is the patient volume overloaded or is the patient dry? Well, on exam, there might be a little bit of JVD and some pedal edema, but the creatinine is up, so why is the creatinine up? Because maybe they're dry, but the pedal edema makes it think maybe the volume overloaded, and then you get a BNP, and that's still elevated, but the prior BNP was also elevated, but it wasn't quite as elevated as it is now, so, and then we got the echo, and the echo wasn't much change, but there was like some diastolic dysfunction, so is the patient volume overloaded or the patient dry? That, my good friends, is the work of synthesis. So we have thesis, we have antithesis, but the work of this age, I think, is synthesis, that we stand in an ocean of data, and a lot of the data is conflicting, and there are algorithms, and then people fall out of the algorithms, and so we're stuck. We're in this age of synthesis. And so that's what I think. The age of synthesis. So we've moved from priest to philosopher to scientist to something else. We are synthesizers. Huh. Do you agree with me, or are we something else? So I invite you all, go back to your phone, and you should have this on your phone. And I invite you to vote. How do you identify as a healer? First of all, give me a thumbs up if you have this on your phone. Okay, awesome. How do you identify as a healer? Are you a priest, a philosopher, a scientist, or are you something else? So I've done this with my residents, and we actually took this word cloud and made a little pin that we put on our lanyard, so that when you're working in the workroom and someone might ask, hey, what is that with all those words? And you would say, oh, that's how we as a group identify as healers. And we took our word cloud and we turned it into a t-shirt. So Grace, I'm going to send this word cloud to you, and you can send it to this good group of folks. Facilitator, something else, scientist, teacher, priest, philosopher, king. Ooh, king. Collaborator, storyteller, coach, something else. Boy, because the bigger the word, the more people have voted for it. So the something else is really fascinating. Teller, healer, spiritual, liaison, story, collaborator, teacher, scientist, philosopher, partner, combination, king, coach, healer, liaison, partner. Oh, you guys, thank you so much. This is so cool. Combined, scientist, healer, partner, philosopher, priest, teacher. Oh, we're still going. Healer, sufferer. Oh. Collaborator, spiritual, something above. Oh, we're still going. Grace, we're still going. Philosopher, teller, combined, liaison. Okay, friends. Give me a thumbs up if you thought that was pretty cool. Okay, I thought this was, they teach you in preaching class that first you got to preach to yourself, right? If it's not true to yourself, it's not true to anybody else. But you guys, this is just so fascinating. And so, Grace, I'll send this to you. Thank you, thank you, thank you. This is what my people look like, the MedPeds gang. And so I'm just so grateful for your attention and for your enthusiasm and participation with all this. So thank you very much. I think we have some time for questions, right? I'll put this up so you can.
That's really fascinating. To be a worker with God, to use the means that He has provided. Medical work has always held a special place in the Adventist tradition. In fact, this is why I described it as the right hand of the gospel. And here's another quote I particularly like. Quote, the gospel practiced, the compassion of Christ redeemed. Here in Loma, our motto is to continue the teaching and healing ministry of Jesus Christ. And I want to focus on the word ministry for a little bit, because I think this is how it gets us to how we can be a worker with God, as this is what I described. Now, ministry is a word with several meanings. It is a noun. It can be used to describe a vocation. It's also a noun that can describe an action, a ministering or caring for somebody, as in like she is a minister. But I believe the teaching and healing and ministry of Jesus Christ encompasses not one, but both of these needs, the structure and the practice, and the intersection of the two, which is our system. When an individual performs an action, this is practice. When a group of individuals do the same action for the same purpose within a common structure, that is a system. Our hospitals are devoted to healing and teaching. Our schools are devoted to healing and teaching. Are we and our system devoted to ministry? So I want to give two examples of ministry, both on the personal and systemic levels. So, thank you very much. So first, the personal example. So personal ministry is based on relationship. And I teach our medical students in our medical ethics curriculum that the morality of medicine is based in that patient-physician relationship. You cannot know what is the next right step for your patient abstracted from the relationship that you have had with your patient and by extension, the patient's family. So recently I was on service and I had the privilege of caring for a little boy whom I'll call Eli. He is a boy with severe developmental delay, and unfortunately he contracted an influenza infection which progressed to pediatric ARDS and then progressed to severe lung scarring. He needed high ventilator settings, and it was doubtful he would be able to continue to live without the ventilator. There was so much that was unknown. Could he be extubated? How confident was I in my prediction that he would need to be ventilator dependent for the rest of his life? What was going to be the quality of life if he had to remain on the ventilator? Could he live at home? His parents, our team, certainly myself, we struggled to figure out what was the right thing to do. In the face of uncertainty, no amount of technical expertise, information from the internet, requirements from insurance companies, or even professional guidelines could give us the answer. The answer lay in personal ministry, in the relationship between the physician, the patient, and the family. In my relationship with Eli and his parents. After a deep conversation over a few days, his parents and I made a decision to withdraw life-sustaining treatment. Now, I'm describing this as a joint decision because I truly believe that this is a decision neither of us could have made on our own. Now, I wasn't alone in ministering to this family. Eli had been in the PICU for 3.5 weeks prior to my starting service. So I was building on the ministry that the team before me had provided Eli and his parents. Now, this is the power of system. I felt a deep connection to Eli and his family, and they shared with me that over their month-long stay in the PICU, they felt a connection not only to the individual clinicians, but also with the unit. I want to say a couple more things regarding ministry as a system. All of us within a system perhaps have a duty to create a type of system that is responsive to patients and families. Systems come in many forms. This is why we have systems-based learning. We have systems-based practice. We have a PICU within a system, a larger hospital system within a hospital network. I believe that physician ministers have an obligation to each one of the systems they work in. Several years ago, a friend of mine, a physician who graduated from medical school a couple years ahead of me, was diagnosed with metastatic cancer. He needed surgery, he received chemotherapy. When we discussed his experiences, he lamented that being on the other side was, in his words, so dehumanizing. This was a sentiment that echoed what I've heard from so many other patients, but it was especially powerful coming from my friend, a physician, an insider. He, along with many other patients I've spoken with, expressed that their clinicians were kind and caring and attended to their needs, but it was a system of medicine that appeared to chip away at any dignity they felt they had. One example is the NPO order, in which a patient is not allowed to eat or drink for hours prior to scheduled surgery or sedation. Now, we do this with great intentions because we don't want a patient to aspirate. We want to protect them from any sort of lung damage during the sedation, which is great, but then the system takes over. It's not uncommon for patients to be made NPO when? At midnight for a procedure the next day. I've certainly done this. I used to teach my students to do this. But how many of you had a procedure that went right on time?
So I've always sort of rationalized it when I was a resident. Well, if an unexpected opening happened at 8 a.m., I didn't want my patient to miss out on the opportunity to be able to get their care advanced. Again, all good intentions, but where's the scrutiny for such a practice? Again, how often do openings happen at 8 a.m.? And if they do occur, who chooses which patients get pulled out and sent to the scanner first? What are the chances that my patient will benefit from a systemic practice of prolonged NPO times? Now, to clinicians, being NPO may not sound like a big deal. For those of you who are hospice, you might feel like you are NPO. You walk into the hospital at perhaps 7 and you don't eat or drink until 8 or 10 hours later. But to a patient, especially a child, it can be significant. So since listening to my friends' reflections, I've tried to look at the systems as ministry. How can the systems provide care that is uplifting instead of dehumanizing? In practicing as a physician minister, perhaps we can avoid the road to quiet desperation. We can find a way to navigate uncertainty, to hold side-by-side concepts that may appear to be in conflict, but then find their way to harmony through relationship, through journeying alongside the patient and their family, through exemplifying the compassion of Christ, and essentially through love. Ministry does not have to be rooted in Jesus Christ, but here at Loma Linda, we have a beautiful example of ministry as lived by Jesus. I hope that this is the age of medicine that we practice in.
Yeah, good.
And I'm happy to start taking questions, so please come on down.
Hi. Oh, state your name and where you came from. How about that? Or what kind of doc you are or something. Say something.
All right. My name's Barry, and I'm from Northeast Washington. I've practiced there in rural Northeast Washington for the last 30 plus years. So thank you for your lecture today. So I'm intrigued by spiritual care. When I look at my community, the things that people are suffering from, we've tried to step outside the clinic model and look at health from the community's perspective. And it's a really unique and special way of looking at health disparities. And what we've discovered is that the things that people are dying from prematurely are things like untreated mental illness and homelessness and addiction. We want to address those things, and we are trying to do so by creating clean and sober housing, for example. But one of the things that I'm intrigued with that you're doing is providing spiritual care for people in your community. I think being a pastor for maybe people that, in our situation, there are many of the people that we serve that aren't sure they belong in a church setting. So we've seen the importance of creating a spiritual connection with them and providing a worship opportunity for them where they feel like they belong. And the second thing is to provide clean and sober housing so that their recovery is effective, but also integrating spiritual care into that process. I'd just be interested in hearing from you. Why did you choose this very different path of creating a worship opportunity for people? And it sounds like they may be people who maybe don't feel like they belong with the rest of us.
Oh, okay. How much time do you have? Actually, I am sensitive to time.
We have time. Yeah, we've got like 15 minutes.
Oh, okay, great. Because actually, this is so. Thanks for your question, and sounds like you're doing important, good work. Yeah, it is amazing. What sounds like what you're doing. So this idea of physician as minister and like holistic care, this is, boy, wouldn't it be nice to go to a medical school that has a school of religion embedded within it? Oh, wait, there is one I know of, right? Here at Loma Linda. This idea of physician as minister is really provocative. And, if you were in New Haven, they might run you out of town because it's so provocative. But when I was a med student, I was the pastor of this church in New Haven. I don't know if anyone's been in New Haven, but it's a pretty rough and tumble town. And so, if you're a church that has a med student as the pastor, let's just say you don't have a lot of cash to hire a part-time minister or even a quarter-time minister. So I'm serving this little church, and back in the day, we had paper charts, and so I would, work on my sermons using the hospital note paper, Yale New Haven Hospital, and I'd have the title of the sermon and the scripture, and I'd be writing patient notes and working on my sermon. And my attending came and asked me what I was doing, And I said, oh, tomorrow I'm preaching the sermon. And he was one of those, he was sort of this older guy, and in this kind of curmudgeonly way said, oh, well, physicians are the priests of today. And and they kind of walked away. And I think he did it to sort of needle me, I guess. But boy, that was a long time ago. And I've thought about that a lot, actually, because I think, where did you go? This idea, I think, we might not want to be the priests or the ministers of today. Physicians might not want to be the ministers of the day for our patients. But I do think our patients come to us for absolution, reconciliation, hope, and so this model of physician as minister, maybe it's a model that's been thrust upon us, and that we're trying to figure it out, and that we learned the Krebs cycle. And now we're trying to figure out how to impart hope upon patients where there are good reasons not to have a lot of hope. Anyway, I don't think I answered anybody's question, but I think it's getting a little bit about what you're saying, that the medicine is easy and everything else is hard, and it's easy to prescribe Prozac, but if you don't have a place to live and don't have a job and maybe never finished school enough to get trained to get well, then Prozac's not going to do it, right? And anyway, it's interesting. I think the world of medicine and religion, we like to think, oh, they totally go together, right? They should go together. But we also have to admit there's a lot of tension in the two worlds between medicine and religion. And it's not all bad in the sense, the biggest trend in medical science, I think, has been medical reductionism, right? We love to figure out the receptor so that we can design an antibody, and then we can attach a chemotherapeutic agent to swim through the body, find the receptor so we can zap the cancer cell, right? That's the way medicine has been going, right? Medical reductionism. Find the molecule of kale to cure cancer. And the answer is, a lot of times, it works pretty well, right? Longevity's increased overall. But then, at the same time, how do you get people access to that medicine? How do you impart trust that the medicine's going to work? And the whole gestalt around imparting hope upon that patient. Well, that's the work of ministry. But we on the church side, and I'm a Christian pastor of a rough and tumble church, and we in the church, I think maybe we need to be more scientifically literate, because look what happened with the COVID pandemic and the vaccine, and on and on and on and on and on, right? That it's easy to look at the physicians and kind of wag the finger and say, you physicians need to become more pastoral. But I think we clergy, we need to be somewhat more attuned to these miracles of science that can really help a lot of people. So we haven't figured it out, this world of medicine and religion. I think there's still tension there. At the same time, there's a lot of convergence. And I think as I get older and older and older, I sort of dwell in the complexity of it all, and I'm glad for the messiness of it all. And I'm glad to be here. Anybody else have any thoughts or anything else to share?
I did have one thought. Going through history, it seemed that there were a couple of people or innovations that really propelled forward a certain age associated with the medical practice. What do you think is the development that perhaps propels forward the current age?
Oh, what's going to happen now? Well, I mean, I do think intellectually we're at this age of synthesis. I also think, I don't know, I have this theory that organized religion is going to make a comeback. Or let's just say, where I'm from in New England, in a super academic climate, I think religion has been sort of the intellectual punching bag for a long time. And so when we read the front page of the New York Times, or we hear from Vivek Murthy, our Surgeon General, that we're in this great scourge of loneliness and alienation. And then I show up at my humble church, which is, we don't have a lot of people in our church, but we sing more loudly than I think we should, and we stay for coffee hour far too long. And I think, gosh, I'm in a community where I'm with people of different ethnicities who are old and young, people with different backgrounds, and they treat me like a brother. And I think the antidote to the alienation and the loneliness of our age might be, showing up and sitting in a pew somewhere. I think, yeah. I mean, it's so interesting, right? Like, I also think, at least in, I consider myself a liberal progressive, and I totally understand when people say, oh, the church, and I speak as a Christian pastor, so you could substitute, synagogue, mosque, temple, whatever, but I'll say church because that's my tradition. Church, it's non-intellectual and it's dogmatic and it's all these things. But I think, boy, when I'm there, being at church might be the most artistic thing that I do. I sing hymns. Who does that? Nobody. Like, you show up and you sing, so you're artistic in a way that's really beautiful. We sit and we think about, a sermon, which at least is an intellectual piece. So it might be the most intellectual thing that people do, certainly the most intellectual thing that people do outside of their job. There's the community glue. There's the whole movement of spiritual but not religious. I think if you show up in a worshiping community, well, you're being spiritual, right? Like, you sit and you contemplate eternal questions and your place in the universe. Those are spiritual exercises. And then we worship, which I think in this postmodern age of anxiety and synthesis, the very concept of worship is so foreign, I think. But yet, maybe that's what we're designed to do, is to love God and love people and love the created world. And we do that, we express our love through worship. And so religion, or in my tradition, church, Christianity at least, offers this whole vocabulary, this whole rich architecture of words, of language that medicine, it just doesn't have. And not that because medicine isn't bad because it doesn't have, it's just that because medicine has been doing medicine. We've been doing stethoscopes and microscopes and medical reductionism, and that's why we live longer now than we ever have before. So medicine, as what it does, is really, really good. But I think, perhaps we who speak this other language of hope and love and reconciliation, and the healthful benefits of church, I guess, of being religious, I wonder if we should, articulate that. And it's been a big part of the research I've done in recent years, this idea of, like, what does it mean to flourish as a human? And then what does it mean to be religious as a human? Anyway, I realize there's this rift in front of good-hearted people who probably get it because y'all are here for Alumni Weekend. The last thing I'm going to say, and then I want to hear what other people have to say. I was here and Zane was sitting up there, and then he just stepped out to go to another lecture. He took me to worship here last time I was here in September. And first of all, we don't do that at Yale. Take a break from the curriculum to go to worship. And there were students, well, there was a band, And, you know, typical, like I'm totally surprised. Everyone's there. Everyone shows up, and there's this amazing band. I said to Zane, Zane, that band is like amazing. There was a missionary that came. The speaker was amazing. I was like, Zane, where did you get this awesome band? And he said, well, the band, they're just students. I was like, what do you mean? These 4 students, they do this Monday through Friday? That takes so much time. He said, no, they just take turns. There's so many people who can lead worship in the medical school. They just take turns. And I was so struck by that here at Loma Linda, there's this true worshipful community. You know, after learning about the Krebs cycle, which is important, you know, people come together and worship. And I know I'm talking to the alumni. Zane was telling me that sometimes the students give pushback. They're like, oh, why do we have to do it? Because it's required, I guess, right? It's required?
Yes.
Yeah. So I feel like I want to, as someone from the outside who came in and coming from like a, you know, a liberal, post-religion, postmodern place, you know, I want to tell the students, if there's any students, you know, listening, boy, what a gift that you get to come and pause and be artistic and thoughtful and worshipful and spiritual, because I think that has to shape a person's heart, just sitting in that space in a way that's different than how your mind gets shaped, you know, learning about the Krebs cycle. I think it was really beautiful. So anyway, I'll stop talking. I'd love to hear what other people have to think.
We have time for one more question.
Hey, you should.
Hey, Dr. Doolittle, thank you so much for a fascinating talk today. You know, the historical approach that I really appreciate is how it shows me that, you know, the professional identity of a healthcare professional is to a large extent socially constructed, right? We shouldn't take for granted this is just how things are, because you have shown us things have changed and evolved over a very long period of time, over history. So I was wondering if you would be willing to comment more on, you know, you kind of showed a variety of frameworks and images of what it means to be a physician, to be a healer, to be a healthcare professional. You talked about philosopher, you know, healers as priest, healers as scientists. And I was wondering if you can say a little bit more about, obviously we can't return to previous historical epochs that belong to a very different cultural and historical context, but what are some of the things that you think that are worth resourcing in our time today?
Sure. So I like the idea of the 4 humors. And if anyone was taking care of COVID patients and prescribed tocilizumab, you guys remember that medicine? It's an IL-6 blocker, and we would give it, and then the next day the fever would go away. And it felt very much like the medieval humors. So I like this idea of balance, you know, like we used a cooling humor agent to cool off IL-6, which is an inflammatory humor agent. So I like that idea of, you know, the 4 humors. I also wonder, I mean, I think, honestly, I think medicine's becoming more complex. So maybe I don't need my physician to be a minister if they're going to fix my heart valve, and they do a really, 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 really good job of fixing that heart valve. So I think there's, you know, I think we might be, you know, not fracturing, that's not the right word, diversifying, and that there will be like the technicians who fix the heart valves and remove the tumors, and that maybe there are the translators who are at the bedside making it all work, and then there's the coordinators who figure it all out. We're starting to see that, right? Hospitalists do this, and then APRNs and PAs do a lot of the translation work after the surgeon is done. So I wonder if that's one piece. And the other piece of that is like the big data and the public health folks that really came to fore during the pandemic. So I think, you know, medicine, I think we're going to diversify, and I wonder if there might be a upstream effect, because how that might impact medical training, right? If you don't want to be a technician, do you need to do different things versus those who want to be the technicians? Not sure. You know, we'll see. But I'm wondering about that. And I do like, but I like the 4 humors, and I also like Hildegard of Bingen's idea of viriditas. I think that's just a really beautiful image of the body as a garden. We good?
Yeah, this is great. Yeah. Well,
Okay.
thank you so much. I
Friends,
appreciate
thanks. I'll stick around if folks want to visit a little bit, but thank you so much. I'm really grateful to spend time with you all.